Good morning, everyone. Thanks so much for joining us this morning. Healthcare coverage and affordability continues to be a top priority among New Jersey businesses. Companies want to ensure a healthy workforce, and they know the importance and understand the value of healthcare coverage as an employment benefit for attracting and retaining a talented workforce. But with the onset of the Affordable Care Act, how have New Jersey companies been impacted by changes in the law, and as we know, the continuing increase and escalation of costs for healthcare? Today, we can answer this question with the results of our 2014 New Jersey Business and Industry Association Health Benefits Survey. We asked our members a series of questions. For example, are they currently offering benefits? How much are they paying for those benefits? Have their costs been impacted year over year on providing those benefits? And most important, how are they continuing to manage those costs? We know it's an uncertain time for businesses when it comes to healthcare coverage. The goal of our survey is to provide New Jersey companies with the guidance and information they need so that they can make responsible decisions around healthcare coverage in the future. In addition, this information allows NJBIA to be prepared so that we can properly advocate for issues, whether it be legislation or regulatory changes, to help in this area. Also, it allows us to explore options for looking toward healthcare services and products on behalf of our member companies. So now, to deliver the results of our survey, I would like to introduce Christine Stearns, our Vice President of Health and Legal Affairs. Christine.
Thank you. Thank you all for coming, and thank you, Michelle. I'd like to present the results of NJBIA's 2014 Health Benefits Survey. The survey was conducted in conjunction with Fairleigh Dickinson University's Public Mind poll during the 3-week period in July 2014. The results are based on 583 responses. All respondents are NJBIA member companies, so any references to businesses should be considered as member companies that responded to the survey. The survey examines what member companies are paying for health benefits, how they are responding to rising costs, and the difficult decisions they are making as they select healthcare coverage for their employees. NJBIA undertook the survey because of the changes that are occurring in the healthcare system, which are having a significant impact on employer-sponsored coverage. The survey found that employers are committed to providing healthcare coverage. An overwhelming majority of companies continue to provide health benefits and expect to provide health benefits in the future. However, the cost of healthcare coverage rose steeply in 2014. The cost rose across the board, with small employers experiencing the sharpest increase. We also found that these cost increases threaten businesses' ability to provide healthcare coverage in the future. So let's look at the details. The cost of coverage continues to escalate. 85% of companies reported that their healthcare costs increased over the previous year. Breaking it down, we find that the amount of that increase corresponds to the size of the company. The smallest employers saw the biggest jump, with an average cost increase of about 24% for those with fewer than 25 employees, 16% for those with 25 to 49. Larger companies saw a more modest increase. Those with 100 to 249 employees saw an 8% increase, and those with 250 or more saw a 7% increase. So what exactly are employers paying for healthcare coverage? We asked about the cost of 4 different plans: single coverage, parent-child, husband-wife, and family coverage. Coverage for employee only had an average cost of $7,416. Coverage for parent-child had an average cost of $11,352. Husband-wife, $15,660. And finally, family plans were the most at $19,116. But despite these costs, employers of all sizes remain overwhelmingly committed to providing healthcare coverage. In fact, 87% offer coverage to their employees, and 71% intend to continue coverage in the future, indicating that they are either not very likely or not at all likely to drop coverage. However, this commitment is threatened by escalating costs. Of those companies that say they may discontinue coverage, 9 out of 10 said that reason would be cost. Obviously, some companies cited more than one reason. On average, member companies pay nearly 80% of the cost of employee coverage and about 50% of dependent coverage. And as you can see, the numbers are pretty similar for businesses of all sizes, with perhaps large employers contributing a little bit more to the dependent coverage. These cost increases are what employers pay after taking steps to control their costs, which I'm going to go into shortly. The initial cost increases were communicated to the companies before their renewal were actually quite higher. For instance, 24% cost increases for the smallest businesses actually started out as an average increase of 32%. And as you can see, the businesses of all sizes saw substantially higher initial increases than what they actually ended up paying. So let's look at the cost containment strategies. Employers used a variety of them to both contain costs and then also to pay for those increased premiums. Looking first at the cost containment strategies, more than half of the companies increased the cost-sharing structure, while a smaller percentage, 29%, asked employees to contribute more to the cost of coverage. Other tactics included changing carriers or introducing high-deductible health plans. And naturally, many companies use more than one of these tactics. Even with the cost containment measures, a large majority of employers still saw a significant cost increase. So we looked at how they paid for these costs. And we found more often than not, employers, it ate into employers' own bottom line. This shows the importance to business of offering health benefits to their employees. So 45% of companies lowered their own profits in order to pay for the higher healthcare costs. 35% either froze wages or limited wage increases, and 22% delayed investment in their businesses. Again, many companies took more than one of these actions. Okay, so what does it all mean? The good news is there's strong market-driven support for employer-sponsored health benefits. Even in the face of rising healthcare costs and the disruption caused by the ACA, businesses continue to provide health benefits and are committed to providing them in the future. Businesses do not have to be convinced to provide health benefits to their employees. They offer coverage to retain their employees and to attract new ones. However, rising costs pose a serious threat, particularly for small business. By far, the biggest reason companies are discontinuing coverage is the escalating cost. No matter how valuable health benefits may be, employers can't offer them if they can't afford them. If healthcare cost increases are not curbed, businesses will not be able to afford the extra cost. So the reality is double-digit increases in health benefits aren't sustainable in an economy that is growing at less than 2% per year. It's already forcing companies to make really difficult decisions. Ensuring that coverage is affordable is a top priority for businesses in New Jersey. It's essential to focus on building an efficient, accessible, accountable healthcare delivery system that delivers patient-centered, coordinated care. Value really is the key to containing costs. So our current system is really designed to pay for volume, the number of medical services delivered, not the value of those services. Value is more important. It considers the results of those services in exchange for the costs incurred. And today's physicians and hospitals are really not financially rewarded for delivering that high quality of care. So with that, I'm going to open it up to take a few questions.